Mr. Speaker, I thank the Minister for a very brief advance sight of his response. Mr. Speaker, patients and parents have a right to be angry at the failure of Southern Health NHS Foundation Trust. We in this House have a duty to be angry on their behalf. To read the litany of failure, missed warnings, reports, recommendations ignored and secrecy over the last 4 years would make any reasonable person angry too. And Friday's CQC report shows very little has been done since we last discussed this matter in this House in December. The scandal at Southern Health has happened on this government's watch, and ministers must take responsibility for what has happened to some of the most vulnerable people in our country. We should be angry that Connor Sparrowhawk was left to drown in a bath. We should be angry that Angela Smith took her own life. We should be angry that David West died in the care of this NHS trust. His father was repeatedly ignored when he raised his concerns. All of them denied the care they so desperately needed. Last week, the BBC reported that over the past 5 years, 12 patients who had been detained for the safety of themselves or others have jumped off the roof of a hospital run by this trust. Access to a roof was still permitted to people at risk of suicide. And if all these tragic incidents were the only signs of systemic failure, we should be angry. But there's a much bigger story of neglect and malpractice which aggregates into a major scandal. When the Secretary of State responded in December to the urgent question on Southern Health, he rightly said that more than anything, people will want to know that the NHS learns from such tragedies. The CQC report published on Friday shows that this clearly has not happened. So I ask the Minister, first, what guarantees can he give to the current 45,000 patients in the care of Southern Health and their families that they are safe? Second, where, Mr. Speaker, is the accountability, the culpability and the responsibility? Because there seems to be very little, and I heard what he said about the chair, but does he agree with me that the position of the Chief Executive is now untenable and she should be sacked? Third, will he listen to the heartfelt pleas of the victims' families, campaigners and all of us who are demanding a full public inquiry into Southern Health and the broader issues such as the abject failure to adequately investigate preventable deaths? As the Secretary of State said in December, these issues are not confined to one trust, and the Ofsted-style ratings that he previously mentioned will only make a difference if there is proper accountability and the ability to take action to make real improvements to patient care and patient safety. Mr. Speaker, the families have behaved with such dignity and tenacity, and we owe them a debt of gratitude, but it should not be left to the families alone to push for accountability. I've listened very carefully to what the Minister has told the House today, but I remain unconvinced that enough has changed. 4 months ago, we heard similar reassurances. Today, we are debating the government's failure to act. The time for yet more warm words and hollow reassurances is over. We need action, Mr. Speaker, and we need it now.
Thank you, Mr. Speaker. Well, I thank the Honourable Lady for her response. We're not actually debating the government's failure to respond here at all. The Secretary of State did exactly what he said he was going to do, and the inquiry that's followed from CQC and their work has been produced in the report which we saw last week. It contains a number of further concerns. There's no doubt about that. That's what and people are right to be angry about that. But there is a process to find out what is going on and do something about it, and that process is in place. That's what NHS improvement is doing. It is important that we do that. There is an issue about urgency. I think that's really important. There are things that seem to be discovered and things take time to get done. I'm not content with that in any way at all. But the process is in place to do something about that. The engagement of CQC and the fact that it's ruled out no further options in terms of taking any further action. Its options are quite extensive, including prosecution for things that it's found. This process is not yet finished. But what the Secretary of State began, and there can be no more, the Secretary of State's commitment to patient safety, which he has demonstrated from the moment he walked into that office, cannot be denied by anyone. And this is a further part of that. Other issues that the Honourable Lady mentioned. I asked the same question that she asked about safety to the CQC directly this afternoon. I spoke to Dr. Paul Elliott, who compiled the report. I said, are people safe at the Foundation Trust today? They are safe because CQC, as we know, has powers to shut down places immediately if there is a risk to patients. They have not done so, and therefore I am absolutely persuaded that if CQC had found such risk, they would have closed things down, and there is therefore not a risk to safety in the terms she suggests. As far as the Chief Executive's position is concerned, the power to deal with management change is held by NHS Improvement. Now, I do offer just a brief word of caution. There is a track record of ministers speaking out about the removal of people in positions over which they have no authority at great cost, understandably in situations of great concern when it seems like an angry response is the right thing. It's not the appropriate thing to do. The chair has gone. There are processes available should there be any more management changes necessary. But I think it's really important. Colleagues in the House can say whatever they like. A minister cannot and must say that appropriate processes can be followed, because that is right and proper. In terms of an inquiry, I don't know yet. I want to wait and see what comes out of the further work that's been done in relation to the Trust. I'm not ruling out some form of further inquiry, but remember, the inquiry is physically being done now by the action that's taking place on the ground. And what needs to follow is urgent action to respond to what the CQC has said, not a long drawn-out public inquiry, which is not necessarily the right answer. But should there be more necessary? There might be. But I need to consider that in relation to what further work is being done at the Trust. And in terms of preventable deaths, as I made clear in my statement, I'm absolutely sure that those cases which require further investigation, right across the system, dating back many years and preceding this government, there has not been enough attention to that. We have turned our attention to that, and we will make changes, because that inequality has got to end.